Good afternoon and welcome to our Facebook Live. My name is Jessica Steger. I'm the Executive Director of Clinic Operations for UnityPoint Health Finley Hospital. Today we are going to be talking about a very important topic now that we're seeing that the tri-state area has been experiencing an influx of the flu, and I know we've definitely been feeling it in our urgent care and our other clinics. So I want to take a little bit of time with our nurse practitioner to talk about best practices for preventing the flu, but also tips on managing the flu from the very own comfort of your own home. So today with me is Debi Oldaker. She is our nurse practitioner at our urgent care clinics. Debi, thanks for joining me today.
You're welcome.
First, can you tell me a little bit about yourself and what we're currently seeing in our urgent cares related to the flu?
Sure. So I've been a nurse practitioner for a few years now. My background is family practice. I've been in the healthcare arena with emergency nursing and urgent care for several years. I've been here since the start of the opening of the urgent cares. And so right now we are heavily seeing the influx of influenza patients coming in. Some of the symptoms that we normally see with influenza that's most common is sudden onset of not feeling so well, the fatigue, sore throat, headaches, body aches, fevers. Fevers can be low grade. Some people present even with no fever but still have influenza. Runny nose and cough are all very common symptoms.
And how long are patients typically contagious for once they started the symptoms or the onset of symptoms, and then how long are they contagious for?
Sure. So unfortunately, most people before their symptoms even really erupt are contagious that first day. So day one, and then it seems like day two they start with their symptoms. So they didn't even have symptoms and they're contagious. And then usually they peak about day 3 or 4 with being contagious to other people. CDC recommends 5 days is a good, and then we want them fever-free for 24 hours.
Okay, that's good information. Let's talk about some best practices in terms of preventing the flu.
So to prevent it, one of the major things is hand washing. I can't emphasize that enough. Wash your hands really good. Make sure you're lathering up with good soap and water. Get in between the fingers on the back of the hands. Try to avoid touching your around your face, your nose, your mouth. Are really good. Cover your cough into your sleeve. Throw away your own Kleenexes. If you're homesick, have your own waste can that you're dumping your stuff into, and then you take that and get rid of that. Another thing that people tend to forget about is wiping down the countertops, wiping down the doorknobs, wiping down your remote control for your TV are all really important to prevent transmitting it around.
And also, if you are sick, stay home. Don't go out in the public or around your family. Make sure you stay home, and like Debi said, till you're fever-free for 24 hours and when after those peak symptoms are occurring. So really good advice, and like I said, staying home is the key. Can you give us some tips on how to treat the flu from the comfort of your home? What are some treatment options that patients have?
Sure. So the number one thing that we get asked a lot about is the Tamiflu. So we want that to get into the person within 48 hours of their onset of symptoms if they're positive. And other things, if they're past that time frame, or just good practice for the flu, is to make sure you're drinking plenty of fluids, resting. We recommend that you use either ibuprofen or Tylenol for the body aches and the sore throats. With children under the age of 12, we do not recommend the use of aspirin, so they should also be using either ibuprofen or Tylenol as well.
It's good to know. Anything that they can do for their cough or if they do have a sore throat?
Sure. The warm saltwater gargles is recommended. And then for the cough, what's good is, again, simple things as warm fluids is really good for cough. So your tea and honey would help. And then anything over the counter for age appropriate. So Robitussin is one of the common ones that we use for cough.
Okay. So if someone is diagnosed with the flu, what can they expect for a recovery time?
So normal course of the flu runs between 5 and 7 days. However, symptoms can kind of linger out there for a bit of period of time, for even some people will go past 10 days on certain symptoms, especially fatigue. We see the fatigue lingering with the influenza.
Sure. And should there be any types of infections or anything that they should be careful about that can cause more harm or develop into something more serious?
Sure. The secondary infections from influenza is what we worry about. So most of what you're seeing in the news is the people that have got pneumonia is the most common one. Other secondary infections include strep throat or ear infections. Sinus infections can be a roll-off of your influenza.
Okay. It's good to know, and it's something that you want to make sure that you're watching for in your children or adults. If you have those symptoms and you're seeing them getting worse or you're experiencing more worsening symptoms, you need to follow back up with your primary care provider, or even in that case, the urgent care or the emergency department, depending on your symptoms. Well, Debbie, thanks so much today for sharing this information. I think it's been very helpful and it's very important, especially, like I said, knowing that we're really starting to see our influx in our urgent cares. And if you are experiencing any of the symptoms, our urgent care locations, both our urgent care west and our urgent care east, are open 7 days a week, 8 a.m. to 8 p.m. So if you think you're experiencing these, please come in, get checked out. You'll want to put a mask on when you walk in the door to help prevent others from spreading germs to others. And again, you can visit our website for further information on our clinics at www.unitypoint.org. And thank you for joining us today.